Hi everybody, my name is Mitchell Farmer and this is MSK Lab 3 covering the leg and the foot. Before we get into the lab, I wanted to briefly cover some leg and foot osteology starting with the tibia. So this is an anterior view of our specimen and we have medial and lateral. If we zoom into the tibia and take it into multicolor mode, rotating back anteriorly, this is superior and here we have the medial condyle and the lateral condyle, as well as something known as the tibial tuberosity. Tibial tuberosity is that bony prominence kind of just below your knee. Often it's palpable, and it's the attachment point of the patellar tendon. Recall the patellar tendon as the common tendon of the quadriceps muscles of the anterior thigh. And so all of that is proximal, and then we have the tibial shaft. And if we move distally, eventually we come to this red thing right here on the medial aspect of the tibial, known as the distal medial malleolus. So the medial malleolus is, if you kind of palpate your ankle right now, you feel that bony prominence in your ankle medially, that is the medial malleolus, forming that bony prominence. So then lateral to the tibia, we have the fibula. So the fibula has, it's not as complicated. You have the fibular head and fibular neck, which are going to be important when we're talking about the common peroneal nerve. And then extending between the fibular shaft and the tibial shaft, we have the interosseous membrane of the leg. And then if we follow the fibula distally, eventually we come to the lateral malleolus seen here, which I'm showing with my cursor. And that's going to form the lateral palpable prominence of your ankle, that lateral malleolus of the fibula. Now, inferior to the tibia and the fibula, we have what are known as the tarsal bones. So the tarsal bones are a series of bones that include the talus, the calcaneus, the navicular, the cuboid, and then the three cuneiform bones. I'm going to start us off with the talus. So the talus forms what is colloquially known as the ankle joint with the proximal tibia and fibula. It allows for movement in one plane of dorsiflexion and plantar flexion. And just inferior to it is the calcaneus. So the calcaneus kind of has two important osteological landmarks. Take us into multicolor mode, I will show them to you. So this is anterior and posterior, superior and inferior. So posteriorly, there is the tubercle or tuberosity of the calcaneus. And this is what forms the prominence of the heel. And it's the attachment site of the Achilles tendon, which is going to be the common tendon of the gastrocnemius muscles and the soleus muscle I will discuss later. Then if we rotate medially, there is something known as the Retinaculum tali, which is kind of this bony prominence or outcropping on the medial aspect of the calcaneus. And it's the attachment point of something known as the plantar calcaneonavicular ligament, unsurprisingly extending from the calcaneus to the navicular bone, or for much shorter, it's also known as the spring ligament. And it essentially helps support the talus, which is just superior to it. Now, I'm going to rotate back around anteriorly. And then, if we move distally along the foot, then we have, as I've pointed out previously, the navicular bone, medially. Lateral to that is the cuboid. And then we have the three cuneiform bones, which are pretty easy to remember their names. It's just lateral cuneiform, intermediate cuneiform, and medial cuneiform. And all of those bones together form the tarsal bones. Of course, beyond those bones is the metatarsals. Meta meaning beyond in Latin, so beyond tarsal. And then beyond those are the proximal and distal phalanges, which help form the toes and the big toe. And then the four lateral phalanges. Okay? Then if we look on our model's right or your left, there are two things I wanted to show. There's the superior extensor retinaculum and the inferior extensor retinaculum. And these are thickenings of deep fascia which hold the extensor tendons in place. So basically the anterior compartment of muscles has these tendons that run and will go deep to these, and it holds them in place to the foot. And I will go to the anterior compartment to show you that now. So I go in here and pull out my anterior compartment. And we're going to start over here. So just a quick note on the anterior compartment before I dive in. all the muscles are innervated by the deep peroneal nerve, which I'll go through after I cover the muscles quickly. And then to some extent, they all aid in dorsiflexion of the foot. Now that's the other thing I wanted to show you, is I want to go through a couple of the movements of the foot, because there's a lot of movements of the foot, and I'm going to be just throwing out words like dorsiflexion and plantar flexion and stuff like that, and I want to cover them before I just talk about them. So first, dorsiflexion. So if I zoom out here and go laterally, that lifting of the toes, so this is returned to neutral position, but if I rewind this, that kind of lifting of the toes superiorly, or lifting of the whole foot kind of towards the head, that's dorsiflexion. So it's lifting dorsally. The opposite of that would be plantar flexion, which I will show you later in the lab. The other thing I wanted to go over was inversion, which is also another common thing seen in the anterior compartment or the extensor muscles. If I click on this, foot inversion. So this is a posterior view, and you can see how the foot kind of rotated medially there. So if I rewind this, you can see that movement is inversion. Perhaps it's easier to see if I take us to the front of, or the anterior view, and this is inversion, okay? The reason I'm taking time to show you all this is that I found it a bit confusing when I was learning, and so I wanted to show you before you got into the cadaveric dissection. So I'll exit out of that, and then the last thing I wanted to show you is extension. So in this case, extension of the toes. So basically we have two muscles that aid in extension of the toes. We have the extensor hallucis longus. So anytime you see hallucis or hallux, that is going to be pertaining to the big toe, so to speak. And then of course, anytime you see digitorum, that'll be pertaining to the lateral 4 digits, these guys. 1, 2, 3, 4. And so here we have the extensor digitorum longus, which I will go over briefly, aiding in extension, kind of that upward motion of the toes. And then, as I said previously, the extensor hallucis longus. All right, so now to discuss kind of now that we've covered some of those basic movements, I want to discuss the anatomy proper. So starting with the tibialis anterior. So if I zoom in for us here, the proximal attachment point of the tibialis anterior is the lateral condyle of the tibia, as well as the interosseous membrane. The distal attachment of the tibia, oh, and this is a good time to show you this as well. You can see how all three of these tendons are running deep to the superior and inferior extensor retinaculums. So they're holding those tendons to the foot. Now back to tibialis anterior. The distal attachment of it is the medial cuneiform bone and the base of the first metatarsal. So this is the first metatarsal here. At its base, and also the medial cuneiform bone, that's where the tibialis anterior is going to attach. And it's going to aid in dorsiflexion, which I showed you, and inversion of the foot about the ankle, both motions of which I showed you. So I'm going to hide that now. And I guess just to note on its location, it's the most superficial of the muscles I will be discussing. So I'm going to hide it. And the next thing we're going to discuss is the extensor digitorum longus. So its proximal attachment is the proximal first half of the medial surface of the fibula. So you can kind of see how it attaches all along, this is the fibula, all along the fibula for its first half. And it also attaches to the lateral condyle of the tibia. Its distal attachment is the base and middle, or the base of the middle and distal phalanges. So this is the distal phalange, this is the proximal phalange, or the middle phalange, and it attaches to both of those of all 4 lateral digits. And as I showed you previously, it aids in dorsiflexion of the foot and extension of the lateral 4 toes. And that is extensor digitorum longus. If we hide that, we then have extensor hallucis longus, which attaches to the distal phalanges of the big toe, or the first digit. And that's essentially kind of the 3 primary muscles I want to cover in what's known as the anterior leg, or the extensor muscles, so to speak. Then going on to discuss their innervation. So their innervation is pretty important. for a couple reasons. First, we have the common fibular nerve, which, if you remember the common fibular nerve, also known as the common peroneal nerve, it is one of the two branches or two nerves that help make up the sciatic nerve along with the tibial nerve. So the common fibular nerve, it winds around the neck and head of the femur of the fibula as seen here. You can see it winding around there. And the reason that's important is because that neck is subject to breaking when there's trauma. And if you have a break in that neck and damage to the common fibular, that'll make it so the deep fibular highlighted here and the superficial fibula highlighted here could also be damaged, or they'll just be experiencing damage downstream of the common fibular. Now, an important consideration is how will that present? So basically you have the common fibular, wraps around the neck, gets damaged, and as it wraps around the neck, it divides into the deep fibular and superficial fibular. The deep fibular is what innervates the muscles I previously discussed, those anterior compartment muscles. And recall that those muscles are very important for dorsiflexion. And so since you're not able to dorsiflex your foot, you'll get what's known as foot drop. Foot drop can result in something like a high steppage gait or something like that. So just keep that in mind. Sorry, the program kind of went out on me. Keep that in mind, that damage to the common peroneal could result in that affecting the functionality of the deep peroneal, which could result in foot drop because you don't have proper innervation of the anterior compartment. All right. Now on to the blood supply. So the blood supply, basically you have the popliteal artery, which if you remember arises, I'm going to zoom out here for us, arises from the femoral artery. And then if I zoom in, the popliteal artery gives off a branch known as the anterior tibial branch, anterior tibial artery. And it enters the anterior compartment through this hiatus, or through this space here in the interosseous membrane of the leg. And it's this anterior tibial which is going to provide the blood supply for our anterior compartment. And also important about the anterior tibial is if we follow it distally as it travels along with the deep fibular, if we follow it distally, we can see that it travels deep to the superior extensor and inferior extensor retinaculum. I'm going to hide that. And then as it travels deep to those and passes underneath them, I'm going to hide this as well, and this, it turns into the Dorsalis Pedis. And the Dorsalis Pedis, which you probably know by now, is an clinically important artery because it's one of the peripheral pulses that we can palpate. So let's say someone's hypovolemic and we want to know what their volume status is. We can palpate that, and if it's diminished, that might mean that they don't have a very good effective circulating volume. So the Dorsalis Pedis is a continuation of the anterior tibial, and then its terminal branch is the deep plantar artery, which helps, as it goes deep, it eventually joins the lateral plantar artery to help form the plantar arch of the foot. Okay? So now I'm going to go on to the lateral compartment of the leg, pulling that up. So the lateral compartment of the leg is exclusively involved in ankle eversion. So I'm going to show you eversion. I showed you inversion already. And I'll go to foot eversion here and take us that anterior view. I'm just going to rewind this. So eversion is where you get that lateral motion of the foot about the ankle joint. And this is returning to neutral. Okay. And you can see these are some of the muscles involved in that eversion of the foot. Exit out of that and exit out of this. They also, they're not exclusively involved in eversion because they also weakly plantar flex, but mostly evert. Just remember that. Sorry about that. So the Fibularis or Peroneus longus has two names, Fibularis or Peroneus. Basically, its proximal insertion is the superior and lateral surface of the fibula, or the head of the fibula. And then its distal insertion, as it travels down, it gives off a tendon which goes posterior to the tibia. That may be important when you're trying to figure out which tendon is going to which muscle. Remember, this guy travels posterior to the lateral malleolus, in order to distally attach at the medial cuneiform bone and the base of the first metatarsal. So this is the first metatarsal, and I'm going to hide this and hide this. And then this is the medial cuneiform first metatarsal. And it's going to attach to both of those. And that's how it's going to aid in eversion as it pulls from this direction. Okay? Now, since there's a longus, of course there is a Fibularis Brevis. I'm going to hide longus. And here we can expose Fibularis Brevis. It has the same action, but the only difference is that it attaches much more distally along the fibula, highlighted here, kind of on that, like, you know, distal 1/3 or 2/3 of the fibula. And it just attaches to the base of the fifth metatarsal and the lateral cuneiform. So instead of crossing underneath the foot, it attaches to the base of the fifth metatarsal, but it has the same action. Now, these muscles in this lateral compartment are innervated by the superficial branch of the common peroneal. So recall there was that deep branch, which I discussed already, innervating the anterior compartment. But then there was also that superficial branch, which innervates the lateral compartment. So if there's damage to that, you could see why there would be difficulty everting the foot. Okay? All right, so just one more compartment to go here, the posterior compartment. Hopefully I'm not going too fast for you. And here's the posterior compartment. Okay, so before getting into the posterior compartment, I wanted to discuss a couple of motions of the foot again. So starting with plantar flexion. So recall dorsiflexion. In dorsiflexion, the foot kind of comes upwards like this. Well, in plantar flexion, you're going to see the opposite. You'll see the Achilles tendon will kind of pull on the calcaneus, and then that'll result in plantar flexion. So that's plantar flexion, and then this is returning to a neutral position. And then above that, you have dorsiflexion. Okay? Exit out of that and exit out of that. All right, so they do the posterior compartment is going to be important for plantar flexion, but it's also going to be important for toe flexion. So I'm going to show you toe flexion really quick, and then we can finish off this lab. So here we have the flexor digitorum brevis, and then you can see the tendons of the flexor hallucis longus and flexor digitorum longus also entering the plantar region to attach to the phalanges. So I'm giving you a view from the base of the foot, but if we kind of go laterally, we can see how it kind of curls the toes downwards. So this motion here is flexion of the digits, the 5 digits. Okay? So now to discuss the muscles proper. So first I'm going to discuss, there's kind of 2 compartments within the compartment of the posterior leg. There's superficial and deep. Superficial is going to be on the model's right hand side from this posterior view, and the first and most prominent muscles are for sure the gastrocnemius muscles. These are, guess what colloquially could be called the calf muscles. They're, hide some stuff here just so we have a better view. Their proximal insertion is going to be the medial and lateral condyles of the femur, highlighted here. And then their distal insertion, this is pretty important, is that they have a common tendon known as the Achilles tendon, and this is also going to be the common tendon of the soleus muscle, which I will show you shortly, and it's going to attach to that tuberosity or tubercle of the calcaneus in order to aid in plantar flexion. So if I hide the gastrocnemius muscles, and sorry, just one remark on the action of the gastrocnemius muscles is plantar flexion, but also, very importantly, they're the most powerful knee flexors. So recall how I've said one of the axioms of MSK is if a muscle crosses a joint, it will cause a movement within that one of the planes of that joint. So this is clearly crossing the knee joint, and so we know it's going to perform an action of the knee. And if I take us to that view, I can show that to you. So here is knee flexion. And here is our gastrocnemius muscles, which are going to be very important for this movement of knee flexion. I'm going to exit out and exit out. So I just didn't want to miss that or lead you astray there. So now I'm going to hide this. And so now deep to the gastrocnemius muscles, we have the soleus highlighted here. So the soleus muscle, or soleus, means flat fish. And that's quite evident. You can kind of see how someone would think this looks like a flat fish. Its proximal insertion is something known as the soleal line, which is kind of the area of the superior posterior tibia, as well as the medial border of the posterior head of the fibula. So here's the fibula and tibia. Its distal insertion is going to be that Achilles tendon or calcaneal tendon, where it eventually attaches to the posterior calcaneus. And it aids in plantar flexion of the foot. Okay. I'm going to hide that. And actually, real quick before I hide that, I just wanted to say it aids in plantar flexion of the foot, regardless of the degree of flexion of the knee, whereas the gastrocnemius only aids in plantar flexion when the knee is extended. So that's just something to consider. I'm going to hide that, and then we can talk about the plantaris. So plantaris is kind of an odd muscle. It has a very small muscular segment and then a really long tendinous segment. Its proximal attachment is the posterior tibia and the interosseous membrane, and it's deep to the two muscles we just discussed. Its distal attachment is a bunch of different things, so I'm not going to show you them, but basically it's the navicular, the cuneiforms, the cuboid, and the base of the second, third, and fourth metatarsals. And it aids in inversion. Oh, my apologies. That was not correct. Its insertion is the posterior surface of the calcaneus, along with those two previous muscles that I discussed. Sorry about that. Somehow I got discussing the tibialis posterior. So I'm going to hide plantaris, and now we're going to go on to the deep muscles, which do include tibialis anterior, seen on the model's left here. So just before we discuss those, we have the tibial nerve, which I've highlighted here. I'm going to show it because I have it hid. And the tibial nerve is going to be what innervates our posterior compartment. But I'm going to hide it because it's kind of in the way of us having a good view of the muscles. So discussing the deep muscles from the model's medial aspect towards lateral. So first medially we see the flexor digitorum longus. As I said, it's the most medial of the group, and its proximal insertion is the medial surface of the tibia, whereas its distal insertion is, show us from the base of the foot. You can see that, and I'll rotate around, you can see how this is the highlighted area, these are the tendons of it, and it's inserting onto the base of the distal phalanges, highlighted here, 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 and here. And so unsurprisingly, it aids in lateral flexion of the four lateral digits, and it also assists in plantar flexion, as well as it supports the longitudinal arch of the foot. So sorry for all the views I've kind of been zipping around on this model, but kind of when you get to the feet, there's a lot of going under the feet and going over the feet and stuff like that. So I'm just trying to cover all the angles necessary. So now for the tibialis posterior. So the tibialis posterior is what I was talking about before by accident. Its proximal attachment is on the posterior tibia and fibula and the interosseous membrane. It's deep to the flexor digitorum longus and flexor hallucis longus, and it has a diverse set of attachments. So this is what I was discussing earlier. It attaches to a bunch of different places: the navicular, the cuneiforms, the cuboid, and the base of the second, third, and fourth metatarsals. And it aids in plantar flexion and inversion. Plantar flexion and inversion. I'll hide that. And then finally, we'll discuss the flexor hallucis longus, which has a very similar, it causes flexion of the big toe, much in the same way the flexor digitorum longus causes flexion of the lateral four digits. Its proximal insertion is the inferior 2/3 of the fibula. So if I zoom in, you can see how it attaches along the fibula here, highlighted in blue. And then its distal insertion is the base of the distal phalanx of the hallux, or the big toe. Rotate around here. So it attaches to the base of the distal phalanx of the hallux, okay? I'll hide that. And then the last muscle to discuss today is this odd muscle known as the popliteus. So the popliteus has a proximal insertion on the posterior aspect of the lateral femoral condyle and lateral meniscus, highlighted here and here. and its distal insertion is the posterior surface of the tibia. Now, it's a very short muscle, and its action is kind of interesting. Kind of the thought of what it does is that it rotates the tibia medially relative to the femur. If the tibia is fixed, it rotates the femur laterally relative to the tibia. This is thought to unlock the knee joint during initial flexion action of a fully extended knee. So it kind of unlocks it, allowing the other flexors to allow it to continue flexing, basically. So kind of an interesting muscle, but you guys don't need to know too much about it. All right, and then just a quick note on the popliteal and its relative branches. I already showed you the anterior tibial, but it goes without saying that there is a posterior tibial. The posterior tibial, it runs down the posterior compartment, providing some blood supply to some of those muscles, but then it passes posterior to the medial malleolus. And this is important because this is another one of the palpable arteries in your foot if you're looking for distal pulses on that posterior medial malleolus. Okay? And then eventually it forms the medial and lateral plantar arteries. All right. So that's a quick rundown of Laboratory 3 of MSK. Hope you enjoyed it, and I will see you for Laboratory 4.